Joining us live via Skype tonight is Dr. Blair Reese of the Quinlan College of Medicine. We thank you so much for joining us tonight, Dr. Reese.
Sure, thank you for having me.
Okay, so first today, Ballad Health said that most of their cases are in people in the 20 to 40-year-old age range. However, we've been told they are not the group of most concern. It's usually more severe. This illness is more severe in older people. So what are these numbers saying? Should we be concerned about this?
Sure. So I think the important thing to realize is that whether you're 1 or 101, you're just as likely to get infected with the virus. We worry about the older age group because they're more likely to have severe illness, be hospitalized, and even die from the virus. But having a large number of 20 to 40-year-olds be positive with the virus is not surprising. The important thing to realize from these numbers, though, is while most of those 20 to 40-year-olds are going to be just fine and have more of a mild illness, they can very well be passing it on to their parents and grandparents who may not be as lucky and may not survive the illness.
There's been a lot of talk of sheltering in place. Dr. Block, the dean of the medical school, told us that we should be sheltering in place right now. The governor has held off on making that decision so far. Do you think there should be an order like that in our area yet?
So I actually do think that there should be. I agree with Dr. Block. We have community spread here now, and that means that anyone that you see could possibly be infected with this virus. I think the important thing to think about is not just so much protecting ourselves, it's really about protecting your loved ones, protecting your parents and grandparents, protecting those that have underlying medical conditions. And the way to do that is to stay home. Every single time we go out and eat in a restaurant, play a game of pickup basketball, we are potentially not only exposing ourselves, but possibly infecting other people. And I want to remind everybody that we believe that you can be contagious up to 5 days before you have symptoms. So you may feel great and may feel good enough to go out and play pickup basketball, for example, but you may be infecting all of your friends at that time.
We've been hearing a lot about our area has reached the tipping point, whether we can really make a difference in slowing the spread of this virus in our area. Now, do you think, and we know that the numbers are going to get worse before they're going to get better. What do you see? How are we at a tipping point, and what do you see happening if we go either way?
So the important thing to remember, I think you just quoted the Tennessee numbers today at 950 or so. Our tests are taking about 5 days to come back. So the positives that we have today were people that were tested on Saturday or so, about 5 days ago. So the numbers even that we're seeing are lagging behind where we truly are today. And I think that it is so imperative that we all do everything we can in our power to slow the spread. We do not want to be in a situation here like our colleagues in New York City are in, where they're talking about running out of ventilators and that kind of thing. We still have a chance to make a difference. We are not to the point that we should throw up our hands and say we give up. Not at all. We can make a difference. We can stay home, and that will have real world benefit, not only for yourself, but also to all the people that you love in our community.
Is there any evidence yet, or is it too soon to show that we are flattening the curve?
So I think it's a little too soon. Any public health effort that we take with this particular virus, it's going to take about 10 to 14 days until we see the benefit. So that is really important for people to understand. I don't want people to say, oh, well, we've been social distancing for 5 days and I'm not seeing any change in the curve. Well, we wouldn't expect that you would. It's going to take about 10 to 14 days. So what we do today is going to affect our numbers 2 weeks from now. So there's a delay. This is not an instant gratification type of a thing.
It's more of a marathon, not a sprint.
Exactly.
Okay. Now, how worried should we be with the last couple of instances, the last couple of positive cases in this area? We were told may have been by community spread. How worried should we be about the beginning of community spread in our area?
I don't think that people should be, super anxious and stay up at night or anything, but I think that this should be a call to action for each and every one of us, that every single one of us can possibly be infected and can possibly be spreading this. So I want this to be a call to action to stay home and not to spread this disease.
That leads me to my next question. What else do we need to be doing to help prevent the spread, to help flatten this curve?
So, I think the best way to think about it is to pretend that you are infected. That is the way that I encourage everybody to think about this. If I knew that I had the infection right now, would I go visit my parents that are in their 60s and 70s? Would I go, to a restaurant? If the answer is no, then we need to be staying home now. That's what we can do to flatten the curve, to slow the spread. On top of the other things, wash your hands, cover your mouth when you cough, and those types of things. I think it's really important, instead of thinking of this as how can I protect myself from getting the virus, I think a more useful way to think of it is how can I protect my 70-year-old mom that I love dearly? How can I protect my aunt with diabetes? And the way to do that is to stay home, as difficult as that may be, to not see our loved ones.
And your family has probably had to follow all these rules as well.
Absolutely. And I'll tell you, for the past about week and a half ago or so, I have encouraged my family really to shelter in place, meaning that they are not leaving their houses except for really essential items, or maybe to go for a walk around the block a couple times a day. And my family, we're all very close. We have Sunday dinners together every week. My children adore their grandparents. And this has been very, very hard on all of us, especially my children. But the most important thing to me is that when we come out of this on the other end, that my family is still intact. And the way to do that is to keep everyone that can stay home. And, I can't stay home as a physician. I have a duty to see my patients, but I have to stay away from my family members because of that, to help protect them.
Dr. Blair Reese from the Quillen College of Medicine, we appreciate all of the hard work that you're putting in, not just you, but all of your colleagues, other medical professionals, doctors, nurses, everybody who's on the front lines. We appreciate you all, and we thank you for taking the time to talk to us tonight.
Sure, thanks for having me.